Motegrity pharmacodynamic studies. Motegrity prucalopride is indicated for the treatment of chronic idiopathic constipation, or CIC, in adults. Motegrity, a selective 5-HT4 receptor agonist, was shown to increase both the number and amplitude of high-amplitude propagating contractions, or HAPCs, which increases bowel motility. In a pharmacodynamic study in patients with CIC, a single 2 mg dose of Motegrity increased the number of HAPCs during the first 12 hours versus an osmotic laxative treatment. In another study, treatment with Motegrity 4 mg once daily, which is 2 times the maximum recommended dose, for 7 days in healthy subjects increased the amplitude of HAPCs without affecting colonic phasic activity versus placebo. Here, as shown in an integrated analysis of 3 randomized, placebo-controlled, dose-finding studies in 280 patients with CIC, once-daily treatment with 2 mg Motegrity reduced mean colonic transit time by 12 hours from baseline versus an increase of 0.5 hours from baseline in a placebo group. Important safety information. Contraindications for Motegrity. Hypersensitivity to Motegrity. Reactions including dyspnea, rash, pruritus, urticaria, and facial edema have been observed. Intestinal perforation or obstruction due to structural or functional disorder of the gut wall. Obstructive ileus. Severe inflammatory conditions of the intestinal tract such as Crohn's disease, ulcerative colitis, and toxic megacolon megarectum. Warnings and precautions. Suicidal ideation and behavior. In clinical trials, suicides, suicide attempts, and suicidal ideation have been reported. Post-marketing cases of suicidal ideation and behavior, as well as self-injurious ideation and new onset or worsening of depression, have been reported within the first few weeks of starting Motegrity. A causal association between treatment with Motegrity and an increased risk of suicidal ideation and behavior has not been established. Monitor patients for new onset or worsening of depression and emergence of suicidal thoughts and behavior. Instruct patients to discontinue Motegrity immediately and contact their healthcare provider if they experience any of these symptoms. The most common adverse reactions for Motegrity, greater than or equal to 2%, are headache, abdominal pain, nausea, diarrhea, abdominal distension, dizziness, vomiting, flatulence, and fatigue. Use of Motegrity in specific populations. Lactation. Motegrity is present in breast milk. Consider risks and benefits of breastfeeding. Pediatric. Safety and effectiveness in pediatric patients have not been established. Renal impairment. A decreased dosage is recommended in patients with severe renal impairment. Avoid Motegrity in patients with end-stage renal disease requiring dialysis. Motegrity works differently. It is the only FDA-approved 5-HT4 receptor agonist for the treatment of adults with CIC.